Hello and welcome to another episode of Real Health with me, Michael Porter. Well, let's dive right in. Metabolic syndrome is a state of health in which various conditions and diseases affect a person all at the same time, creating something of a perfect storm. These might include heart disease, diabetes, high blood pressure, and cholesterol, among others. So today, Dr. Mark Opperman is in studio to explain the signs and symptoms of metabolic syndrome and give us a better understanding of this condition. Mark, let's start with sort of an overall concept of what metabolic syndrome actually is.
Michael, I want to take a step back and explain what metabolism is.
Right.
Metabolism is where you take food and turn it into energy in your cell. Mm-hmm. And it makes up the sum total of all these biochemical processes that happens in the body. So metabolic syndrome is a cluster of conditions which leads to an increase in risk factors for things like cardiovascular disease, the development of diabetes, cancer, and obesity.
Okay.
It's all got to do with insulin resistance and dysfunction of adipose tissue, in other words, your fat cells.
Right, right.
Now, I think when people hear the word insulin resistance, they think diabetes.
Absolutely.
It's actually not the same thing. Insulin resistance is when the body's cells becomes less sensitive to the effect of insulin. So let me just explain this. Your energy in the form of glucose needs to move from the blood to the cell. And for it to happen, you need a transport system. So think of insulin as the transport system. So we all know what happens if you have to move coal from a mine to a boat. Mm-hmm. If you put it on a train, quick, easy. If there's a lot of coal and you're now starting to put it on trucks because your network is down, what happens? It backs up the traffic, so these glucose start accumulating, and it accumulates in fat cells, and it damages the road structure, all these track damage.
The potholes.
So, yes.
Yeah.
So, it increased insulin damages blood vessels and it damages tissue, and it leads to a buildup of glucose, raising your glucose levels in the blood, and that's what causes the diabetes.
Okay.
But to have insulin resistance, you have to have dyslipidemia. And dyslipidemia means that your bad cholesterol, the LDL cholesterol, is elevated, your good cholesterol is lowered, and your triglycerides, which are fatty acids in liquid form in the blood, are elevated. So that's insulin resistance.
Okay. So now, again, it refers, you talked about the metabolic syndrome leading to things like cancer, cardiovascular disorders, diseases, things like that, and diabetes. So this cluster that we talk about, this is now a syndrome as opposed to a disease on its own.
Absolutely.
Multiple things that cause it. Yeah. So if we are heading in the direction of one of these diseases, are you guaranteed to end up with metabolic syndrome, or how does that interplay work?
You know what, actually that's a very interesting question. The answer, I would say in a nutshell, is yes.
Okay.
Because if you have insulin resistance, that has an effect on your blood pressure.
Yes.
So now it starts pushing up your blood pressure. If you have insulin resistance, you start elevating glucose levels. But that in itself has an effect on your cholesterol.
Okay.
And with the elevation in cholesterol, you start getting atherosclerosis. So blockage of your arteries, creating stiff artery syndrome, increasing the blood pressure. So each of them feed into the other one.
Right.
What we need to understand is to make the diagnosis of metabolic syndrome, you have to have insulin resistance, number one.
Okay.
And then you diagnose it by looking at the patient. Now you have to go and do a couple of investigations. Number one, what is the waist circumference?
Okay.
If a waist circumference in men is more than 102 centimeters, and in women, 88 centimeters. So that's one. Second one, hypertension or elevation in your blood pressure. If the blood pressure is higher than 130 over 85, which is quite low actually, it's the second diagnosis of this condition. 3, it's changes in your cholesterol levels.
Right.
And here we look specifically at the good cholesterol, HDL, lower than 1. And your triglycerides, the fatty component, higher than 1.7.
Okay.
So if you have those, we already have 3. Then an increase in your fasting glucose. And again, it's far from diabetes. It's only 5.6.
Okay.
If your fasting glucose is above 5.6, you have one of the defining criteria of metabolic syndrome.
Okay.
You need 3 out of that 5. In my practice, I also include a change in hormone levels. So hypogonadism,
Okay.
estrogen in women and testosterone in men. Your thyroid plays a role. And again, each of these conditions leads to the other one. So insulin resistance leads to dysfunction in your thyroid, leads to cholesterol, etc., etc.
Okay.
So we need to understand that this now is a pandemic.
Yes.
In the 19...
Sorry, I was going to actually ask you, what is the prevalence of it at the moment? When you call it a pandemic, how many people are dealing with this?
In the 1980s, 8% of the world's population had metabolic syndrome.
Okay.
40 years later, it's 36%
Of the world's population?
of the world's population. We see it specifically in patients who have followed the trend of obesity. So 1 in 5 people in America, 1 in 3 people in America have metabolic disease.
Okay.
1 in 3.
Sure.
And in African cultures, as well as in your Native Americans and in Indian patients, the figure is up to 40%.
Sure.
Of people. And it's because of obesity. Obesity is the driving force
Right.
behind all of this.
I mean, it's interesting because we're talking about this cluster of conditions. These conditions are so interconnected.
Absolutely.
And I mean, when we look at the body as a whole, it's a system. And one thing out of kilter in the system causes a chain reaction of a sort. So how important is it if people are dealing with one of these conditions which form part of the syndrome, how important is it that they get it under control before it leads to the next one?
So that's incredibly irrelevant for one simple reason. The signs and symptoms, or the symptoms of metabolic disease, let me rephrase, is silent. You don't know that you have it.
Right.
The only sign that you have is an increase in abdominal circumference.
Okay.
So when you are more than 100, go and check your blood pressure, go and check your glucose levels, go and check your cholesterol levels.
Right.
That's the most important thing, is screening for this. And if you don't, your risk, again, cardiovascular disease, heart attacks and strokes, diabetes, cancer, all of those diseases are progressive.
Right.
Now, there's a lot of things that contribute to this.
Okay.
Physical activity, number 1. People have become sedentary.
Absolutely.
We work in our office, we go home and we play in front of the TV, and you go to bed. 30 minutes of exercise per day, moderate intensity, at least 5 days a week,
Okay.
is essential. It immediately lowers your risk for cardiovascular disease and stroke.
Yeah.
It's not about losing the weight. It helps with losing the weight, but it lowers your risk for further complications. Exercise also lowers your stress levels, which is one of the biggest contributing factors to metabolic disease.
Yes.
Exercise is going to improve your sleep quality. One of the most underdiagnosed problems, I think, that we have in today's society is obstructed sleep breathing or obstructed sleep apnea, where people do not get good quality sleep. You know, it's not about sleeping 7 hours, it's getting 7 hours of good quality sleep.
Yeah.
And a lot of people are not breathing properly. And it's not only the people that snore and who are obese.
Right. I mean, again, we come back to the fundamentals of good health, which is sleep well, eat well, and exercise. And in moderation,
manage your stress
manage your stress levels. But if you're doing all three of the first, you're going to probably get the fourth under control. But that mindfulness, all of those things. Absolutely. So, Mark, I mean, we're running out of time for this discussion, and I want to go deeper. So we're going to have you back for another discussion around this. We'll talk about some management and some other aspects of it. But thank you so much for just clarifying the insidiousness of this condition. I think is quite extreme.
If there's only one thing that I could get across today, it's about go and screen.
Yes.
Because it's preventable, and you can prevent serious complications like diabetes and cancer if you identify and manage this early.
And Mark, you do that screening. Where can people get hold of you?
You know what? We're at the T Clinic here in Joburg. The number is 010-824-1393. But you can do this at your pharmacy, at your healthcare provider. You do not have to get to a specialist center.
Okay. Great. Mark, we'll be talking further on this. I look forward to having you back in the studio, but thank you for the discussion today.
Thank you, Michael.